Healthcare systems across the continent are struggling to cope with an increased number of hospitalizations, and the need for more medical staff remains high. Portugal has been hit hard by the promise of better working conditions elsewhere, as Filipa Soares now reports.
A tribute to the health professionals fighting on the front line against COVID-19. Behind the art is the story of a real Portuguese nurse, Sofia, who works at the main hospital in Porto in northern Portugal. She caught the virus back in March and faced a long and hard recovery. Last week she started working back on the front line and will do 7 18-hour shifts in a row at €7 per hour. Low wages and working conditions are to blame for the migration of 18,000 Portuguese nurses, according to the Order of Nurses institution. Young nurses, Sara and Maria, are preparing to work at a hospital in Bristol, in the UK.
Maybe in other countries, for example England, where we want to go, they offer better conditions because they also value nurses more.
Right now, in fact, in Portugal, there are no conditions for nurses to be good at what they do, learn and at the same time be safe and be valued. There is no room for us in this country at this time.
Portugal has invested in training for its nurses, but countries like Spain, UK and Germany are not only offering better hourly rates, but transport and accommodation too.
Portugal cannot lose these nurses because we receive requests from national institutions every day. The truth is that nurses compare the conditions they have here with the conditions they have in other countries. They are much more attractive, and naturally they choose that.
Many hope that the Portuguese government will rethink its strategy for nurses and offer them something more enticing to keep them in the country. Filipa Soares, Euronews.